Hello all. So, good evening. So, today we are going to see a case presentation video. Okay. So, you might have seen previous videos. So, you might have seen all the techniques which we have placed in the YouTube. Okay. And along with this, so I am continuing with the debate session. So, I am having the Emmanuel Benjamin and also the Prasanna Arasa and along with my students and mentees. So, what is the case presentation based on the both ortho and neuro rehab? Okay, so I am going to say a case. So I have seen a case long back ago, a patient of 54 age. Okay, a patient of 54 age. He is a male. Okay, now, so whenever we are going to see a case presentation, we need to understand the past history and the present history. Okay, and all other the details. Okay, his name, his age, and all these conditions. Okay, now his age is 54. Now, while returning onto her home, so he felt he met an accident. Okay, so this accident, so that is a simple accident, but he has undergone a burst fracture of thoracic 12th vertebra. Okay, so we have seen n number of fractures. Okay, green stick fracture and spiral fracture and different fractures, but this type of burst fracture is most common in the vertebrae. So here thoracic 12th vertebra has gone for burst fracture. Now, which type of rehabilitation, which type of process is needed for this patient? So he was rushed to the hospital and he was sent into ICU. Now, orthosurgeons on one hand and neurosurgeons on one hand, and they were discussing on how to give a new life for this patient. So what is the outcome now? This patient has met for a paraplegia along with other conditions, that is urinary incontinence and many other associated conditions. Now, orthosurgeons has decided to place a plate fixation for the thoracic 12th vertebra. Okay, why? Because here a ortho fracture has been happened. Okay, now orthosurgeons undergone the surgery. Now, after the surgery, what is the outcome? The patient cannot able to stand or sit on his own. Okay, why? Because burst fracture created an impact on the neurological area. Understood? Now, neurosurgeons suggested to go on with the physiotherapy. Orthosurgeons suggested to go on with the physiotherapy. As we have already debated the concept of ortho and the neuro rehab, now we are having both the rehab specialists, ortho and the neuro rehab physiotherapists. Now, they both combine to work out to bring the patient to a normal life. How they did? So, on one hand, the ortho rehab and the neuro rehab combine and they share their thoughts on basis of giving a proper medical physiotherapy. Okay, on outcome of 6 months. Okay, on outcome of 6 months, the patient was made to stand. Okay, with support. Okay, not on his own but with support. Okay, so with the help of all the stimulator, muscle stimulators, electric nerve stimulators, and the passive movements for the lower limbs. Okay, and other n number of new techniques which was applied for the patients. Okay, so it took about around 6 months for a proper recovery for the patient to stand on his own with support. Now, when we are going for a conclusion, which therapist is going to hold the hands for this? Either the ortho or the neuro. So the conclusion is both combines to form and gives a proper treatment, and this is the proper physiotherapeutic technique for rendering the patients to a normal life. So as we enter into the hospitals and all, when we see this type of burst fracture cases, okay, so there might be an ortho rehab therapist and there might be a neuro rehab therapist. We should not fight among ourselves like so I am greater, you are lower, and no, don't go for these type of controversies. Both are equal and both are gem for the society. As you are going to enter in this world as a physiotherapist, you need to hold on to the standards as a proper physiotherapist. So hope you guys have understood this clinical presentation of this real life man, and now after 2 to 3 years of observation, now he is going for his work. Okay, and he and his family members are very much happy for the physiotherapist. Okay, so we'll meet on next video with a new content. Thank you guys.